Hello, thank you for joining us. I'm Lisa Gren, and I'm happy to present on behalf of Doctors Frost and Benson on some work that we've been doing related to staff impacts from the COVID pandemic. The framework for what we did was the 7 domains of health, which specifies that we can think about health in these different domains and that there are overlapping influences. And for this particular study, we wanted to think about physical and emotional or mental health, as well as perhaps identifying some financial impacts to staff members. We started with some background looking at the impacts predominantly to faculty, and found that what was being reported from work done early on in the pandemic was that faculty members felt they had overall less time available. And in particular, this was found among those who had young dependents. Women also had overall sort of a 5% greater decline than men did, and that these two were additive. That is, being a woman and having young dependents was a greater impact than just one of those. And the second piece of work that was published was some focus groups that showed that both caring for children or caring for older adults had impacts on clinical faculty, and that this raised the concern that there was worry about people's promotion timelines, concerns that there was less mentoring available to them, and that would impact forward progression. Another study that was done looked at students and showed that most staff and students perceived adverse impacts. One of the things they looked at was increased workload, and both students and staff reported increased workload early on in the pandemic, but that staff were more likely to report a higher workload than students, and that there were some social and emotional impacts. So people were concerned about not having interaction with their peers. They reported having lack of motivation, and then loneliness, anxiety, those kinds of comments also. This report in the New York Times that looked at remote work and how we were going to think about coming back to work, or whether remote or hybrid work would continue. And the findings were that established employees were in favor of continuing remote work, as were women and people of color. However, there's a challenge referred to as the proximity bias, which is that if people aren't visible in some way to decision makers, they may not be able to participate in decisions that will impact their future of work. So this is in particular difficult for people who already feel underrepresented, and we refer here to women and people of color who often feel underrepresented in the workplace, or underrepresented in terms of being able to make decisions. And so this can lead to sort of a vicious cycle where you may prefer the remote work because it works for your personal life work balance, but that may make you even less able to be seen by supervisors. And in this article, they talk about some best practices, which refer to making expectations clear in terms of written handbooks or guidelines, providing mentoring, and creating opportunities for what they refer to as virtual water coolers so that people can interact together. That led us to our study, which is a mixed methods study. The survey portion is looking at what are the impacts perceived by staff. We wanted to focus on staff because there's less written in the literature about them. And then we also wanted to explore in focus groups what people thought about policy that was working or not working, things they'd heard about that they'd like explored, that kind of thing. And so that work will happen in the summer of this year. Finally, that will culminate in a case study that we should have finished up in fall of this year. I want to talk here about the survey because that's where we have data collected so far. So in April of 2022, we sent a survey link to a Qualtrics survey. This is an IRB approved 33 item survey. And the advertising about this link went out through Staff Council Communications, Pulse Communications, and college deans who could access listservs and send to their staff. I'm going to report on responses that we've received through April 28th. So this is considered preliminary as the survey is still in the field. And I also want to acknowledge that the funding for this has come from the Utah Center for Promotion of Work Equity Research through the pilot program. Dr. Benson received that award, and Reach U2, which is a mentoring program for undergraduates, and we will have a summer intern who will help with focus groups and preparing the case study. So responses received through April 28th were 158. We deleted those respondents who said they had some other role than a staff person at the time that we were focusing on for our analysis. And we also deleted 2 people who completed only the demographic portion. That left us with 141 surveys to analyze. This gives you a sense of who the sample is. So 77% identify as women, and 75% reported full-time staff work. The majority or the largest portion of respondents came from the School of Business, but we do represent a variety of other places on campus, so fairly broad representation. Because of the article about what were best practices, we wanted to ask people about the kinds of interactions they had with their supervisors. So we'll start down here. The frequency of interaction, 44% said they had the same levels before, some were higher, some were lower. The next thing we asked about was that level of interaction appropriate or the right amount that you needed? And most people felt that they were getting the level of interaction they needed. So strongly agree and somewhat agree are in the green, and then the disagree somewhat and strongly are in the orange color. And so you can see that the majority felt like they were getting the kind of interaction they needed. The last thing we asked about was, did they feel supported by their supervisor? And we also asked about coworkers. And if you add the percentages up together here, you'll see that in both categories, we're at 90% or higher. So generally speaking, staff felt supported. And I've listed here for you some of the ways that they felt supported. And so I think overall people had a pretty positive experience in the way the remote work and subsequent iterations of how we worked rolled out. We asked about productivity. First of all, over 75% had worked remotely for at least 10 months, many of them longer than that. Staff reported having some of them with an increase in work. So working more hours was about 35%. As we look at the literature, Leo Philo, which was one of the articles we had looked at in the background, said about 2/3 ended up with reporting increased work. Some of that difference may be due to the timing of when the question was asked. So the Leo Philo study was conducted early on in the pandemic. Ours clearly is later. And so things may have sort of calmed down in terms of hours. We asked about productivity. Over half said they had higher than their pre-pandemic productivity. And about 35% said about the same. So productivity doesn't seem to have been negatively impacted to a great extent. And when we asked about what people would like going forward into the future, 70% said they would prefer a hybrid setting, and 20% said they would prefer being fully remote. So only a small fraction are really interested in coming back to full-time in-person work in the way that we had before the pandemic. We asked about work-life balance, and specifically we wanted to know about the kinds of extra work people were doing either for children or adults for whom they had caregiving responsibilities. So we asked about educational needs for children, social needs for children, physical needs for adults. This is things like running errands and grocery shopping and those kinds of things. And then social needs for adults who may have felt more isolated. And so what we find is that with these 4 categories, I'll draw your attention here to this middle row. We're reporting means and medians, but basically men were picking up more work in essentially all 4 of those areas, as were women. So we don't really see a difference there. But if you look at the amount of time per week that they were spending, you can see that women were reporting a minimum of 9 additional hours on average using the median, whereas men were reporting about 4 additional hours per week. And so this is where we start to see the difference. So everybody's picking up extra work, but women are picking up more time in that work. And so that sort of aligns with what was reported in the previous studies, that women were more impacted. When we asked about finances, about 87% received some form of financial assistance. You can see that the 2 big ones here are stimulus through the CARES Act in 2020 and stimulus through the ARP Act in 2021. And so almost everyone received some sort of assistance. The changes that people made to reduce their expenditures came in the form of changes in discretionary spending. So people reported things like spending less money on food because they weren't going out for food, or less money on gas because they weren't driving, or economizing in some way, moving in with other people to reduce their housing. But really, discretionary spending was the largest category there. We also asked about health, and we asked in terms of physical health and mental health. What you see is that we're kind of in the middle is where people were. Either their health was the same or their health was worse. We have reported better or unsure. And it's about the same amount who report worse health for both physical and mental health, at about 45% each. So in summary, in terms of work, people, the staff that we interviewed here at that responded to the survey here at the University of Utah, fewer of them reported increased hours due to the pandemic than we see in the reports that looked at other places in the country. Overall, people felt supported in the move to remote work or hybrid work. And they also reported that they had experience with remote work. They could be productive that way, and the majority favor hybrid work going forward. When we looked at comparisons between women and men, what we found was a non-significant, from a statistical standpoint, increase in the hours of caregiving for women compared to men, with the median that we reported of 9 versus 4 hours per week at a minimum. This happens because we asked them to report in intervals of hours, so 1 to 5. So at the minimum, we took 1 as the minimum. So people could be higher than this, but this is what we were seeing at the minimum. And then the other things we found were this report of decreased health. A significant portion of the sample reported decreased health, both physically and mentally. That a very large number, almost 90%, received financial assistance in some form, and typically federal, and that about 2/3 made changes to their discretionary spending or other types of spending to reduce their financial outgo. Where we think this is headed in the future is that there's a tremendous amount of work to do in the policy area. Workers clearly favor hybrid work, but there are implications for how we implement that. So if it's true that workers who are experienced are successful at hybrid work or remote work, how do we think about that when we bring on new employees? How do we train them? How do we build their skills over time? How do we set expectations and evaluate them in a remote setting? And I think there's also work to be done in terms of when teams need to be built to work on particular problems. How do we do that with a mixture of in-person, fully remote, and hybrid? I had mentioned that there was an additive effect associated with being a woman and also having care for children. And this ties into a framework of intersectionality where different levels of disadvantage can be additive. And so we'd like to apply that frame as we continue to gather responses and expand our analysis. How do we think about how race and ethnicity impact people, how their level of seniority impacts them, how levels of disability impact them? So that's future work that we'll be doing with the survey. In terms of future work on this particular study, we have plans to look at faculty, staff, and students to determine whether or not their needs are different, whether the impacts to them are different. We will also be doing the focus groups where we will want to ask about the concept of resilience and what leads people to feel successful in that area. Certainly we'll be exploring policy with them. And given that we anticipate there will be other kinds of disruptions besides this pandemic, we'd like to think about how do we prepare for the next disruption. These are the resources we used in case anybody wants to take a look at any of those. And then finally, I will leave it here for questions and discussion. Thank you.